So today is February 13th, 2023. This is Kelly Zakovic representing the City of Savannah Municipal Archives. I'm interviewing Jeff Klibert
That's it.
for the Proud Savannah History Project, and we're conducting this interview over Zoom. So thank you for joining us. Just to get started with some basic biographical information, can you tell us your full name, please?
Sure. My name is Jeff Klibert.
And when and where were you born?
I was born in New Orleans, Louisiana in 1980.
And how long have you been in Savannah?
I've been in the greater Savannah area for 13 years now.
Are you in Savannah or are you in?
So right now, I currently live in Statesboro, but my second home is Savannah in the sense that we're constantly going back and forth.
Great. And can you please tell us your pronouns and how you identify?
Sure. My pronouns are he, him, and I identify as a cisgender heterosexual man.
Okay, so now kind of diving into our project here, can you describe your involvement with the LGBTQ community in the greater Savannah area?
Of course. So yeah, my involvement is mostly coming through my role as the director of the Prism Clinic. And that initiative started about 3 years ago, which is awesome. At the same time, kind of mind-blowing that we were able to kind of get this going through the pandemic. But mostly as a behavioral health specialist, I supervise students who are providing behavioral health services for LGBTQIA plus individuals seeking help with just emotional behavioral health kind of difficulties. In addition, I will go and kind of network with other providers to ensure that we're opening up more doors for gender and sexual orientation affirming care. So mostly it's different types of community work, mostly serving in a professional capacity, but all associated with kind of, I think, pushing the initiatives and the agenda of the Prism Clinic forward and making Savannah a little bit more inclusive in terms of accessing behavioral healthcare services.
Super. And you were nominated to participate because of your involvement with the Prism Clinic. You said it got it started about 3 years ago. Can you tell us a little bit more about the work that does?
Sure. So about 3 years ago, a few faculty at Georgia Southern just started interacting more with, I think, the board of First City Pride Center. And the one thing that I think the board members were just consistently seeing is community members with unique needs that couldn't easily be accessed and maybe were outside of the price range of some of those communities to receive, I think, high quality behavioral health services. And I think there was just a targeted effort to kind of fill the gap and creatively think about how we can extend First City Pride Center resources to more of a behavioral health kind of component. So again, working with Dusty Church, working with Donovan Edward, working with Brandon Weiss, we just came together and figured out how we can, I think, use current Georgia Southern resources to develop, I think, a better platform for serving this community. That happened 3 years ago. We got it off the ground. Then we got a big HRSA grant. Again, it was close to $1 million grant. And that, I think, provided us with an influx of resources to take a really good idea and make it very tangible for the community. So as a part of that grant, we're providing services to individuals who are obviously seeking care. We make those services very accessible. So telehealth, in person, they're very affordable. So the first 5 sessions are free. Anything after that first 5 sessions, it's $5 or less. So it's a sliding scale between $1 and $5. And then we serve the greater, I think, Savannah area, which includes about 12 different counties, I believe. So again, we're reaching more individuals who are in need of help, and we're doing our best to not only provide services, but train trainees in a way that will help them provide, I think, culturally sensitive services to the LGBTQI population wherever they are. So again, that's kind of the main, I think, the bigger points of how the Prism Clinic evolved. And we've been able to do more and more each year in terms of the type of services we offer.
Can I ask for clarification? What is a HRSA grant?
Sure. So HRSA grant is a big federal funding agency. Essentially, they will go into different communities, identify specific public health, social problems that exist, and they will essentially fund researchers, program developmenters to go into those community and fill gaps, fill needs. So HRSA, I believe, stands for like Health Resources Administration Services. So it's a big entity in the federal government. They put out a call for addressing addressing under-researched, under-resourced communities in a way that's going to make services more accessible and affordable, while also providing training for individuals who are merging into a professional role with those experiences so they can actually work in those communities in the future.
Very cool. So who are your providers, or who are you training to provide these services? Are they students, or?
They are the students, and they are community members who have different kind of professional roles in serving the LGBTQIA plus community. So again, a lot of them are advanced doctoral level students who are going to be psychologists in the next year. Again, we have a good network of providers, social workers, nurses, counselors, substance abuse counselors, who all receive kind of didactic training on kind of the newest trends on how we can support not just the alleviation of distress, but also the maximization of well-being across different kind of scopes of action. So it's all this kind of interprofessional community coming together, and we often do a lot of training so individuals in social work can be kind of can acknowledge what psychologists are doing, and at the same time psychologists can kind of be more aware of what social workers are seeing around LGBTQIA plus issues.
Is that a pretty common approach to kind of have this sort of intersectional approach, or is that a newer technique?
It's been around for a little bit, but it's now kind of receiving kind of more of this national attention, because you can basically meet multiple needs of an individual in kind of this one very familiar setting that can be built around very affirming and safe practices, policies, and procedures. So again, I think it's more of where the field is going. Specifically as you're serving kind of under-researched, under-resourced, and I hate to use this word, but it's very true, marginalized communities, where one agency can build up trust in a way that allows for these individuals to not only engage in the services that they were originally seeking, but other services that may support well-being across multiple platforms, finance, medical, social, all those things can actually be, I think, increased just by kind of bringing a large community of professionals together to serve in an interconnected way.
Are a lot of your providers also LGBTQIA individuals, or you run a range of individuals?
Yeah, we have a lot of diversity in the identities that they provide. We have found that the community, I think, responds more easily when matched with a provider that is, identifies as gay, identifies as bisexual, identifies as trans, queer. So we do have a lot of providers who hold those identities. And I think in that way, it eases some of the maybe barriers that come along with just seeking services and staying in services. So we are training a lot of individuals who are part of the community to work more integratedly within that community. And as someone who does identify as cis, and someone who does identify as heterosexual, I also learn a lot from those individuals about how to be an advocate, how to be an ally. So while I am technically in the director role, there's no structured hierarchy there. So a lot of what we do comes straight from the stakeholders, straight from the people who are receiving services, straight from the First City Pride Center board about what they're seeing. I'm more of an individual who, once the problem is recognized, helping them find a solution, standing by, I think, and alongside these individuals as they work through some pretty heady stuff. So that's kind of my role. And then again, we bring in a lot of individuals who hold those same identities to work in these spaces.
Very nice. Who are your patrons in terms of age or regional, where are you finding most people are accessing your services?
Um, so we're a generalist type of agency. And what I mean by that is, again, we've seen individuals as young as 3 or 4, and we've seen individuals as old as 86, 87, 88. There's really no cap. So the reality is, anybody who identifies as part of the community, friends and family, allies, if they need services, we're there to help them access those services as much as we can. We still have a lot to grow, but at the same time, it's not isolated to just adults or just kids or just people with specific identities. We do find that all of our clientele come from the southeastern portion of the state. In fact, we've had more requests. I think that's one of the beautiful things about the community in itself. I think once resources are available that are considered affirming and validating, the word spreads pretty quickly. And we're seeing more engagement. We've had a lot of requests from Atlanta, a lot of requests from Macon and Augusta, and we're doing what we can to fill those requests via telehealth. But the reality, a large proportion of our clients come from anywhere from Statesboro, Savannah area, Pooler, Hinesville, Brunswick. Those are kind of the major areas that we're seeing a lot of participants from.
Are there similar programs elsewhere in the state, or are you guys pretty unique in what you're offering?
Yeah, so that's a great question. It comes with a really kind of not so hot answer, in the sense that a lot of programs aren't doing what we're doing. I think there's been barriers for programs to work effectively with these communities because they're not willing to put in the time to get to know the community, to see what the needs are, to put words into action so the community sees that you are willing to stand beside them as they kind of navigate different challenges. So we were rather lucky. We had a lot of integration with First City Pride Center. There was a lot of communication. There was a lot of board meetings. There was just a lot of, I think, listening and responding to what the needs were. And then kind of this creative framework just kind of molded itself. And the grant helped. But the reality here is there are few programs that I know of across the nation that are offering a very specific and tailored set of experiences to the LGBTQIA+ population in this regard. Of course, there's a lot of advocacy groups. There's a lot of community support resources available in a lot of communities. However, given Savannah, where it's placed, a lot of rurality surrounds the city itself. This is kind of a one-in-a-kind program here, and we're pretty proud of it. We still need to grow a good bit, but it's unique, and there hasn't really been a model that we've been able to follow to kind of help us navigate. It's more of just staying within the community, building as quickly as we can, and responding to whatever new challenge arises.
That's awesome. That's something sounds to be proud of. So you offer behavioral health services. Are there other services that are involved in this?
Right now, it's mostly behavioral health, but I think as we talk about behavioral health, it's connected to all other types of health. We're sending a lot of our trans clients to connect with TransFam, which is a social support group in First City Pride Center. It's an amazing group led by some amazing people that I've fortunately been very lucky to kind of get to know. At the same time, if we're seeing something that is behavioral health in nature, but stemming from medical difficulties or social difficulties that require the intervention of a nurse or a doctor, we connect our clients easily to people who are hopefully vetted as affirming providers. So again, while individuals may not initially come to us for anything but behavioral health services, we're able to do a lot of unique assessments to kind of get them connected to different resources that they may need in the community, or, even not just somewhere in the state.
Nice. Are those other resources pretty plentiful in Savannah? Are there any big gaps that need to be addressed?
There are gaps. I think the resources available for the community in Savannah are emerging. I think there's a lot of good people trying to do a lot of good things, but there's a lot of barriers from a policy and procedural perspective that are making this more difficult than it probably needs to be. One of the major gaps that I think we need to start addressing is kind of the intersection of LGBTQIA plus identities and low income status, homelessness, poverty. That's really the biggest barrier in a lot of ways in pursuing behavioral health. We have the tools, I think, to help people. However, the reality, there's just a lot of external forces that are just kind of blocking individuals from moving forward. And it's very real. I mean, if you can't find a stable place to stay, or if your family has disowned you and then you're kind of out on your own and you don't know what resources are available, that needs to come first in terms of kind of getting people situated so they can kind of tackle some of the other things that they're facing. So there are large gaps there. I'm happy to say, though, that there are other gaps that are being filled. I think Savannah it's much easier to get trans individuals to affirming resources so they can talk about different types of medical interventions that are more affirming. I know a lot of psychologists in the community who are taking more affirming stances in terms of how paperwork is disseminated, how interventions are tailored, I think, to the unique experience of individuals with different identities. So I'm seeing a lot of movement from medical stuff, from social work stuff, from psychological stuff. Unfortunately, there's just individuals that slip through the cracks because, again, they just can't access any services, mostly due to like lower SES kind of status.
And how do you get word out about your services?
Yeah, I mean, our best friend in the world is First City Pride Center. And I can't shower enough praise and appreciation for all that they've done to get us connected. But essentially, if we have a bit of information that needs to go out, we let Donovan, we let Dusty, we let Lawrence know, and it's blasted pretty quickly, and people just know. I think people in the community are so well connected. And again, First City Pride Center is just an amazing resource that, if any true, I think, permanent inclusive change is going to happen in Savannah, it's going to happen through First City Pride Center because of the people who work there. They're quite amazing.
They have been, yeah, they've been great and partners for us as well. Are your services, most other than telehealth, are they offered through the center, at the center, or
Yeah, so right now we have been working at the center on a few days per week. So again, I believe at the end of last year, we had individuals there on Tuesday and Thursday. And again, there's some space issues there. First City is great in terms of kind of what it brings, but eventually we're going to need a bigger space. So again, that's when we're going to apply to more grants to see how we can expand not just the services we provide, but the space in which we're providing them. So yeah, again, there are in-person services at First City Pride. We're working to ensure that all individuals who come seeking services there are welcomed in an environment that is safe, where they feel that their information is protected. So again, it's a nice, I think, joint effort in making services happen. But a lot of what we do is telehealth, mostly because we're trying to access individuals from very geographically isolated areas.
Since you're with Georgia Southern, does Georgia Southern have a pretty inclusive environment for LGBTQIA students and staff, would you say?
Again, I think it's emerging. I think there's a lot of work to be done. But the reality is I've met a lot of great people, a lot of great representatives of the community who are partnering to do, I think, a lot of unique things. One of my partners, Nikki DiGregorio, is an amazing advocate, and we're able to kind of do, I think, some unique ground level work that's needed to inform what good policy, what good procedures, what good programs we need to develop. So I think there is a really good foundation at Georgia Southern. I think, again, there are barriers there that we're pushing through. I'm hopeful in the next, 10 years that we will be able to build centers at Georgia Southern that are specific to building well-being within the LGBTQIA plus community, and helping students find a home, so they don't feel so isolated, and at the same time they don't, I think, don't have to worry about what a safe space looks like and how to go about finding it. So I'm hopeful that in the next 10 years we're going to see some significant growth, because again, I think what we're finding at a national level, more attention is being paid to the medical, mental health, and social needs of the community. So you're seeing more grants funds being allocated towards the support of the community in general.
Very nice. And what do you hope for 10 years from now for the Prism Clinic?
So right now I think it's affiliated with Georgia Southern, and I want to maintain that affiliation. But my goal is to build First City Pride Center up enough to where we can hire a director, we can hire counselors and nurses and social workers to work specifically for the center, telehealth and in person, full time. So again, my goal is to usher us into a space where First City Pride Center has the capacity and the resources to run the Prism Clinic in a more integrative and a more holistic fashion. Right now, I think the Prism Clinic is building, but we're incomplete, because there's so many needs that we're not meeting because we just don't have the person power to do it right now. So we're doing what we can, but we're proving that we have a good foundation to build. So in 10 years, I'm hoping that there's a director who's over a number of mental, behavioral, physical health professionals, and then when individuals are in need of help, First City Pride Center can immediately provide that help in a way that'll support well-being, and in a way that's going to support, I think, wellness. So that's the goal, to usher into a bigger sphere of providing services to the community.
So I think you've spoken on some of them. Are there any other challenges faced by the community in the Savannah area that you hope to address, or or that we should know about even?
Yeah, I think, I think Savannah is growing, and I like the direction it's going in terms of being more inclusive, being more socially just. I think there are just threats. Look at Florida. I think that's a major threat, and some of the policies that are being put forward there, and how that's going to transpire over to the state of Georgia. I think protecting marriage rights are always going to be important. I think finding more inclusive ways of representing the community through business, through different community development projects. I think that's going to be a big thing. And I think there's just going to be a lot of hurdles because we're a changing society and we change pretty slow. But I think if we're going to get on the right side of history here, we need to expand our understanding, our awareness of the community as a really positive force, and driving home a lot of values that I think most Georgians respect. So again, I think at a policy level, there's going to be challenges. I don't know exactly what they're going to look like, but the reality here is I think that's going to be the biggest thing that we're going to need to tackle. How to transfer what we're doing with the Prism Clinic over to more lobbying, over more to advocacy efforts, so we can build policies that protect the rights of the community.
Has any of that political stuff, is that brewing in Georgia right now, or brewing in the community? Have you seen any push from that? or?
Not enough. Not enough. And I think that's clear to anybody who supports the community. There's just not enough. I think you get little hints and flavors of, oh, wow, we're pushing forward here. But a lot of that is in Atlanta. And it's localized to that. And I think at a very regional level, we need more city officials to be able to rise up and stand besides the community and supporting the rights that are deserved to be protected, or just recognizing, hey, first these rights need to be protected, and then fully protecting those rights with policies and procedures that are fair and non-discriminatory. So I think at the state level, you might see Atlanta pushing us forward with some of the initiatives. But at a, I think individual, like regional level, I think we need to see more advocacy-based efforts in the city. That would be my hope, at least.
So on the flip side, what are some of the greatest strengths of the community in Savannah or the region?
Again, as someone who was, I think, invited to participate, to serve, there's really so many. I think if you speak to some of the community leaders, they're going to enumerate them in ways that I can't. But the one thing I think I'm most just happy and just impressed with, there's a sense of resilience within the community. If given opportunities to put their best foot forward, the community does so in ways that are quite amazing. The way that they connect to each other, the way that they protect each other. Mark Hill said something when we were meeting, and he said the importance of kind of building on the shoulders of those who've come before them. So there's a kinship and there's a history there of that support that I think kind of transcends just one generation. And I think there's a respect from those who came before and how they're going to affect where the community is going. A lot of communities that I've worked in don't have that. And I think there's something special within that. So again, there's a building component to it. There's a community and then the support. I think that all generates a communal sense of resilience that's just quite impressive. The community bounce backs from just social, environmental, financial stressors as best they can, but they do so in a way that I think honors the past and celebrates the potential of the future. So that's probably the most impressive strength that I've seen, and something that I'm just really happy to be a part of.
Overall, would you say that Savannah is a pretty inclusive community?
I think so. Again, it's growing. I think inclusivity is an aspirational goal. We'll never really truly get there, but we have to work hard to pursue inclusivity, pluralism, social justice. And again, from someone who identifies as a cisgender heterosexual male, I really like the movement that I'm seeing. Pride was amazing. Stonewall. I think it brings so many people together where you're seeing not just LGBTQIA plus rights happen, but appreciation and celebration of women and the intersectional with different like BIPOC identities. All that happens because of the community and how it's growing. So I like that. I know a lot of individuals from the surrounding area flock to Savannah because there's more support and resources there. And because of that, I think there's a lot of power for the community to do something really, really amazing. So it's becoming more inclusive. Again, it's definitely not where it needs to be, but there's a lot of hope and potential.
You mentioned that there are other providers providing services to the community. Are there any other names that we should know, or clinics, or anything we should know about other?
Yeah, I definitely. The two referral sources that I often use if we kind of get bogged down in the amount of requests. David Lee, he's a provider. He's right on kind of the outskirts of downtown. He is actually one of the individuals who developed some of the transgender and queer kind of support groups at First City Pride Center. He's an amazing resource. Him and his team are serving the community very well. And I would advocate any individuals looking to get, I think, more in-person services. He would be a great resource. Joy Psychology and Wellness. I know a lot of their providers well. They're very inclusive. One of the board members, Jessica Brooks, is a provider there, and they're on top of their game. Again, under from just paperwork, so appreciating like pronouns and identities through their paperwork, all the way through of developing, I think, service plans that are consistent and honors those identities. They do some magnificent work. So those, there are many more, but those are the two primary ones that I think, like, yeah, someone from the community can go there and get some great services and feel as if it's a safe, warm, and welcoming environment.
Are there any like physical health resources to know about?
Yeah, so there are a number of providers, especially for the trans community, I think that are doing some really amazing things. I think Starland, I think their network is really great. We've coordinated with them for HRT and I think gender affirming surgery type things. They are very responsive to the community. I think the process of kind of, and this is a horrible thing to say, of acquiring those types of options for the trans communities can be very stigmatizing. You're basically going to a professional and say, hey, I need these types of interventions, give me permission. And that's just not a great thing to say. And it's a hard thing to do. But the providers over in that community, the providers, I think what we're trying to do with Prism Clinic are really making it a safer space to coordinate and collaborate about what these interventions look like and get them access to those interventions so they can live in harmony with their identities. So, I mean, again, it's been a little slower for me to get involved in the medical community. Any surgeons and other providers who do HRT or do, I think, gender affirming surgeries, I've been impressed with them. But more importantly, that's part of my goal is to get a little bit more indoctrinated in that community so we can provide more integrated support services.
You mentioned the Trans Fam, is it a support group?
Mm-hmm.
Is there anything we should know about that?
Yeah, it's pretty amazing. So from what I understand, it varies in terms of schedule, but there is a telehealth version of it. So for the individual members who are just maybe can't get to Savannah, or individuals who just kind of want to see how things go before maybe kind of making an appearance and kind of being kind of vulnerable or more seen in the group, that's a great option to kind of go and live the experience, to find out what support looks like. There's also an in-person group. The thing here about that I really enjoy about it, it's growing significantly. So, you know, the more it grows, the more providers we can kind of bring in to help support. But really the essential ingredient of making those groups run are just the community members themselves, to be able to share stories, to be able to kind of find support, especially when no easy answers can be found. Those support groups are quite magical in what they can offer. So again, if you have any issues associated with, you know, workplace concerns or issues stemming from, you know, how do I deal with my parents, or just an environment that I'm working in or living in that's just invalidating, that group may not have specific answers, but they do have, I think, unique avenues by which they can provide support, and they partner with you to kind of navigate the challenge you're experiencing. So the topics range from anything like, you know, where to get a wig, to, oh my God, you know, I'm clearly being misgendered at work. And then how to kind of navigate those situations in a way that provides more support and hopefully more avenues for assertive action as a team rather than someone just kind of engaging in these actions as an individual.
Yeah, that's important. I don't think I asked, do you have a rough number for how many individuals y'all support at any, in a year, or, you know, numbers?
Yeah. So this year we just actually took stock. Currently we are seeing 67 clients. And essentially, again, they can be families, they can be couples, they can be individuals, children, older adults. So again, that's kind of where we're at right now. We do partner with our on-site Georgia Southern Psychology Clinic, and they'll take any overload that they can get to. I will also say that unfortunately we're on a waiting list because the requests for services are so immense. So we're doing our best to kind of, get people situated within the community in a way that still makes services accessible and affordable as much as we can. First City Pride Center has been great in helping us do this, but right now our capacity for Prism Clinic itself is around 70, and the psychology clinic can take anywhere between 10 and 20 more clients. So we're creeping up close to 100, which is great, but it's still not enough.
Makes sense. So we've talked about a lot of the questions that we have. You've mentioned some names for us. Are there any other important leaders in the community that we should know about?
My go-to people are all at First City Pride Center. Dusty Church has been amazing. He advocates for the community on so many different levels in terms of kind of making things happen at a political level, coordinating with city officials. He works hard for the community in ways that I can't possibly imagine. So he's been amazing. Lawrence Appenzeller is the current director at First City Pride Center, and he he put on Pride this year. He did an amazing job with Stonewall. He is my go-to line in terms of making sure that services are affirming. So if he's hearing things about, oh wow, there's been an uptick of, let's say, concerns about substance use, then he just lets me know that information, and we try to kind of navigate that situation in a way that meets that need. And he's absolutely amazing. If you've met Lawrence at all, it's just easy to connect with him, and there's such a desire to serve and just be a positive force within the community. And then probably the person I'm closest to is Donovan Edward. He's a board member. He's also one of our students in the PsyD program. So he was actually a former director of the First City Pride Center, and he's the one who made the bridges happen between Georgia Southern and First City. If there's one person directly responsible for the services that we're offering and the Prism Clinic's growth, it would be Donovan Edward. And again, if you got a chance to know him, he's just an amazingly capable and impressive person. We're really so lucky to have him be a part of our program, but he advocates so strongly at every level for the community. It's hard not to, I think, just appreciate the type of things he's offering and what he's doing for everyone.
It's so important to recognize that effort and, memorialize that too. So really, I think that covers most of the stuff that we were asking. Is there anything else that you'd like to share with us about Prism Clinic or LGBTQIA community in the region?
Really, I just think if you're need of services, please reach out. We will do our best to get you hooked up. Again, sometimes that may take a minute or two, but we're going to try to do our best to reach as many people as possible. And again, thank you really to all the people who've made Prism Clinic what it is today. All those people I mentioned. Mark Hill has been a phenomenal, I think, community member, and kind of illustrating where things have gone and where things are going. And again, I'm just grateful. I'm here to walk alongside. I'm here to serve. I'm very happy that the leaders for the community are already in place and are doing great work. And it's fulfilling in terms of my job to be able to work alongside them, because again, they're such amazing people.
Okay, well, thank you so much for sharing your history with us today.
Thanks, Kelly.
Okay, so that's where they'll cut it off. So that was awesome. Thank you so much for telling us all about that. And it sounds like y'all are doing awesome work over there. Everything seems to come back to the First City Pride these days. So
yeah, it's not surprising. Like I said, they welcomed me and I didn't know anything about the community. And now whether from a historical perspective or just from current events, I feel up to date because of all the good work they're doing.
Yeah, they've because I mean, I'm in a similar position, cis het woman, and they've been so welcoming to us. We had a table at Stonewall, we had a table at Pride, and they've connected us with individuals that we should know about and everything. So yeah, it's really cool to hear about, and thank you so much for your time today.
No, Kelly, I love the work you're doing. If there's anything I can do to help you out, just let me know.
If there's anybody that you think would be open to speaking with us, that
Okay.
we should be speaking with, I'm sure that we've asked Lawrence, but I don't know if he's done one or not, but if there's anybody else, even, elders, individuals, just out, send them our way or send me an email and let me know, and we'd love to talk to them.
Yeah, if you need any more providers, I definitely know quite a few people who I think would be interested in kind of sharing their perspective. But yeah, I'll just get with Donovan, and Donovan will give me a list of people.
That sounds good. Yeah. Or send him our way or whatever works. But yeah, that'd be great.
Okay. All right, Kelly. Well, thank you so much for everything, and again, hopefully it was helpful.
Yes, it was. It was really great. Thanks.
So have a great day.
You too. Bye.
Bye.